Welcome to Caring.
Welcome to Caring Well.
Welcome to Caring Well.
Welcome to Caring Well.
Caring Well. Welcome to Caring Well.
Welcome to Caring Well.
Welcome to Caring Well, a Middleton Pediatrics podcast where we have conversations to help you care well for your child. Today we have a conversation with Dr. Elizabeth Davis, a sports medicine pediatrician with Orlando Health. We cover a lot of topics about sports medicine, helping you care for your athlete. So let's go to that conversation. Okay, Elizabeth Davis, thank you for being with us.
Thank you for having me.
This is going to be fun. Before we get into clinical discussions, a lot of things we're going to talk about, would love just a little bit of your background as far as just about you, but then also how you ended up in the professional spot that you are.
I was born and raised in East Tennessee, so I am a lifelong lamenting Tennessee Vol fan.
All right.
Much to the chagrin of all the Gators.
Yeah, you're in enemy territory for sure.
All the Gators and the Seminoles around here. But I was born and raised in Tennessee, and I came here for my residency after medical school. So I did my pediatric residency at Arnold Palmer Hospital.
Okay.
And then I stayed on and did an extra year of a sports medicine fellowship. And I was actually the first fellow in our program.
Continue. There's a fellowship that's still going on. And
yes. So in fact, I just counted today. We are on our 18th and 19th fellow.
Wow. That's
so
great.
Initially in our fellowship, we had one fellow, and then a couple of years ago, we added a second. So now we have two fellows every year that we train and send out into the world to become sports medicine doctors.
So I would imagine when you entered your pediatric residency, you did not know that was what you wanted to do.
I did not. In fact, I came to Arnold Palmer specifically because I thought I wanted to be a NICU doctor. I thought I wanted to do neonatal ICU. And I came here because Winnie at the time, and still is, I think, one of the largest NICUs in the country. It was only, at the time I came, it was second behind Parkland in Dallas. And it was a very high acuity NICU. And they didn't have a fellowship at the time. They do now. And as a resident, I thought, okay, this will be great. I can get all this NICU experience
during your
as a
residency,
resident,
right?
As a resident, which will make me a more valuable candidate in fellowship. And I went through almost my whole residency thinking that I wanted to do NICU. And then I met Jay Albright. I don't know if you remember Jay.
I do remember Jay, yeah.
I met Jay Albright randomly on a second year ortho rotation that I was doing. Actually, it was my hem-onc rotation, and he came in and did the hemophilia clinic where he would take care of the joint kids. And I got to talk to him, and we just got to talking, and I realized he was interested in starting sports, like a sports program. And I was like, tell me more about that. I was like, because I was an athlete growing up. I was a competitive figure skater growing up.
Okay.
Actually, that's where my love of sports, that's where my love of the artistic sports comes in.
Interesting.
So I take care of the ballet. I take care of a lot of gymnasts, a lot of figure skaters, because that was what I did when I was growing up. Anyway, so Jay and I had this conversation, and I was like, he kind of put this little seed in my head that I want to start this fellowship, and I would love to have someone who was an athlete and who was interested in sports medicine. And I started thinking about it, and during my third year of residency, I started to kind of realize that I wanted to make sure I had good work-life balance as a physician. And I thought, when I'm 55 years old, do I want to be working in a level 1 high acuity NICU, delivering 23 weekers and intubating and putting lines in at 3:00 in the morning on a Saturday night? Or do I want a job that's a little bit more 9 to 5 and a little less stressful, at least from a call perspective, right? And so I wound up doing a rotation with Jay in the beginning of my third year, and I just fell in love with it. I fell in love with what he did as an orthopedic surgeon, but what I could do as a non-operative doctor. And I wound up pivoting. My parents thought I was crazy. They thought I was losing my mind. And I pivoted, and I said, no, I want to do sports. This is what I want to do. And so Jay, along with another non-operative guy, actually from UCF at the time, we created the program, and it was not approved when I started, but by October of that year, it had ACGME accreditation. And then I took my boards in July and passed, and then I was a board certified sports medicine doc.
Most of the time, a non-medical person that hears sports medicine physician, they're thinking an orthopedic.
They sure do. They think orthopedic surgeon.
So kind of paint a picture for the role that you and your peers play in this ecosystem of sports medicine alongside orthopedics, alongside primary care.
Yeah. many, many years ago, before primary care sports medicine really became a field, orthopedic surgeons had to see everything. They had to see the knee pain, the little finger fractures, things that didn't necessarily need surgery. You talk to any orthopedic surgeon and they tell you they went to medical school and did residency to be a surgeon, not to see patients in clinic. And I don't mean that negatively. They don't want to spend the majority of their time in clinic. They want to spend the majority of their time in the OR.
That's right. Fixing things they were trained to fix.
That's
right?
what they want to do. Right. So they were using their nurses, their ancillary staff, again, nurse practitioners, PAs, to see all of the stuff kind of that they didn't really want to see, or they didn't think
best use of their time.
Not the best use of their time. Yeah, I don't want to make this a negative connotation. It's not negative. It's just that they want to spend their time in surgery, right? And not everything in sports, not everything in orthopedics needs a surgery, right? You can get away doing injections and physical therapy and other things first. And so what they realized is, okay, we can start this primary care sports where you can have a primary care doctor, so an internal medicine doctor, a family medicine doctor, a pediatrician, an ER doctor, so someone who does primary care. And then they do this sports fellowship, and then they can take care of these athletes. They can actually really take care of everybody until they need a surgeon. And then when there's a problem and, oh, you have an ACL tear. Well, I can't fix that, but I'm going to send you to my surgeon partner who can fix it. And so what we wind up doing is I see myself and my partners, we see all the non-operative stuff. So the stuff that doesn't need surgery. But hey, you might need an injection. You might need, some physical therapy. You might need some other modalities that myself and my partners can prescribe and get you better without needing a surgery.
Okay, well, let's get into some clinical stuff.
Perfect.
No particular order, but maybe one of the most common things that probably is at the intersection of what we and what you do is concussions. What constitutes a concussion? And mild traumatic brain injury versus concussion, the terminology, I'm just going to use the word concussion. Is that still okay?
Oh, that's fine.
Sports medicine?
Yeah,
okay.
mild traumatic brain injury and concussion are the same thing.
Yeah.
They're the same. They're used interchangeably.
Okay. Yeah. So, and I think some of that was probably to convey the severity that this is a brain injury and people would downplay concussions maybe or whatever. So anyway, what in your mind and your clinical expertise, what constitutes a concussion?
So a concussion is any injury where the brain essentially is shaken up or shakes around inside the skull. And in medicine, you get what we call a coup and a counter-coup injury, right? Where the brain hits one side and then ricochets off that one side and hits the backside. So it's the coup and the counter-coup injury. And I think one of the common misconceptions about a concussion is that you actually have to get hit in the head. You don't have to get hit in the head. A football player can take a really hard hit to the chest and almost have like a whiplash type injury. You can also see it in car accidents. You have a whiplash type injury. Your head doesn't hit anything, but then you wind up with the symptoms of the concussion, which are headaches, dizziness, irritability, balance problems, feeling like you're just in a fog. You can't remember stuff. You can't focus. You can't concentrate. Parents will tell me that their kids are not acting like themselves. They're just, something's off. Like he's just not acting like his normal self. They'll be overly fatigued or they'll have trouble sleeping. And those are probably the most common symptoms that we see from concussions.
Do you find yourself in situations often where I'm not sure if this was a concussion?
We see that a lot, actually. Kids will fall and hit their head and have like a big goose egg on the front of their head. And they'll say, well, my head hurts, but it hurts right here where I hit my head. Otherwise, my head doesn't hurt. Like I don't have a headache otherwise. And so those are all things that we as pediatricians and as sports medicine doctors, we kind of have to ask those added questions. Okay, are you having any of these other symptoms? Dizziness, mood changes, fatigue, and if they really say, no, my head just hurts right here where I hit it, I'm kind of like, okay, it's probably not a concussion. But if they have any of those other symptoms, then that's where we diagnose them and say, yeah, you have a concussion, because it is a clinical diagnosis. You can't diagnose a concussion with a CT scan or an MRI. It's a clinical diagnosis. An injury happened, and then this is the outcome from the injury.
Yeah, I think if you were talking about misconceptions, I mean, there used to be a misconception that you had to lose consciousness.
Right.
Thankfully, I think most people realize that's not necessary. And then also, do I need imaging? In fact, the imaging will be normal if it's simply a concussion. Are there other common misconceptions that you find yourself addressing regularly?
Yeah, those are the biggest ones. The
Okay.
imaging question, and then he didn't lose consciousness, so he can't have a concussion. 90% of concussions don't lose consciousness. I think the other thing is that parents still think that they have to physically hit their head on something, and they don't. Again, they can have that whiplash injury. You can have an injury where your body just gets shaken really hard and whatever you hit, and that causes the injury. Some kids, just seemingly innocent things will cause an injury. I had a girl the other day that came in. She was playing Frisbee with her buddies, and a Frisbee took her across the head like this. And I think what actually happened, I don't think it was the Frisbee hitting her. I think it was probably her reaction. She probably whipped her head back, and that's actually probably what did it. And still 4 weeks later, she's having a lot of symptoms. So her parents were very concerned because she's still very symptomatic. And I'm like, this is what we see. I'm like, she's still following that normal path. Where I always tell this story too. I had a 16-year-old one time who fell out of the back of a golf cart going 30 miles an hour. Skull fracture, brain bleed, was life flighted to APH, was in the hospital for a week, followed by neurosurgery. They were like, follow up the concussion clinic, once he got discharged to me. He came to see me. He's like, I'm fine. He's like, I'm not having any headaches. I feel totally normal. And so a kid that you would think had a severe concussion wound up 7 days later in my office and he's fine. And a girl who seemingly has a very mild concussion, right, 4 to 6 weeks later is still having significant symptoms. So that's why we don't really classify severity anymore, because it doesn't matter.
Classify severity of concussions. We still do of head injury, but not of concussions.
Exactly.
Right?
So we don't you have a severe concussion or a mild concussion. It doesn't matter. It's when you're feeling better and when you're feeling back to normal, that's when we send you back to sports. That's when we send you back to activity, right?
Any theories on why the susceptibility varies so much?
There are a lot of theories. There's nothing concrete that we know, but some of the associations that we have, type A personalities, kids who have underlying OCD, anxiety, depression, ADHD, learning disabilities. So if they have off brain chemistries anyway, a head injury can really throw those different brain chemistries really for a tailspin. Teenage girls tend to take a little bit longer because girls just tend to ruminate on things. They tend to worry about things, whereas boys are more likely to kind of blow it off and be like, I'm fine, whatever.
I've seen where in comparable sports, meaning mainly soccer and basketball,
Yep.
that higher rates of concussions for girls playing basketball than boys playing basketball. Yep. Girls playing soccer than boys playing soccer. Yep. And that's part of the theory.
That's part of some of it too. Also, there are male and female differences, right? So females don't tend to have as strong of neck muscles as boys do. So that's why you see more concussions like from headers in girls because of either improper technique. They're not strong enough. Again, they hit another player. Boys can still have the same thing. Boys can still hit another player too. Same thing in basketball. Girls are going up for rebounds, being very physical in their games. And if somebody hits them or they whip their head back, if they don't have that strong neck musculature, they are at higher risk for that injury.
Anything else about recognition and diagnosis? And so maybe, I guess my question would be, do you feel like we are doing a good job? Is it underappreciated, under-recognized? And then the other thing is, what's in the future or coming for recognition?
We're definitely doing a much better job now than we did 15, 20 years ago. Parents are much more cognizant of it. Coaches are more cognizant of it. Here in Florida, our school system, if there is even a thought of a concussion, a kid is pulled out of that sport until they are evaluated by a sports medicine specialist, by a concussion specialist, or their pediatrician. I think the hardest thing about diagnosing concussion is getting kids to be honest. Kids don't want to be pulled out of a game. They don't want to be pulled out of their season because of a concussion. So they will lie to you. They will not tell you the truth. They'll have a headache. The classic example is a football player takes a really hard hit. They're on the ground. You see them get up and they kind of stumble or they shake it off. You see them like shake it because they're trying to shake off that injury, that head injury. That's the number one thing I look for when I'm out on the field covering a game. Any athlete, but especially football. I watch that kid get up from lying on the ground, and I watch them as they come off the field. And that kid will tell me, I'm fine. I want to go back out there. And I do a quick exam and I'm like, you're not going back out, because I know that was a hard enough hit to potentially give you a concussion. We're going to let you sit. We're going to evaluate you in another 10 or 15 minutes and see how you're feeling.
All right. What about treatment? How has the treatment or the way we address concussions evolved over time?
Yeah, well, we're much more cognizant of that, obviously. We don't let kids go back until they're symptom-free. We have all of these tools now. One of the tools I use is something called the SCOTE, the sideline, or it used to be sideline, but now it's Sport Concussion Office Assessment Tool. There's a SCAT, the on the field assessment tool. I use the one in the office. And it's actually, we go through all the questions and we do the symptom score, the sleep screen, the depression screen, the anxiety screen, all of that. We have the kids fill that out before I see them. And then we follow that over time. And until their symptom score comes back to what they were pre-injury, I do not let them return to contact sports. That is much different than what we used to do 15, 20 years ago. We just brought kids in. How you doing? You feel better? You feel like you're back to normal? All right, fine. You can go back out to play. Now, when they go back to play, we do a return to play protocol. It's a slow, graduated 4 to 5 day return to sport to make sure that those concussion symptoms don't come back as we are increasing their
activity
level back to their normal sport. And so what's nice about that, especially within the school system, is that that kid is going back to those practices that are football specific or lacrosse specific or cheerleading specific. So what you're going to do for the football player is not the same that you're going to do for your lacrosse player or for your cheerleader, right? So you're going to do different things to ramp them back up to their normal activity level.
Yeah, and even the return to play, I feel like, has evolved, because we really did used to have kids, in retrospect now, rest too much.
Right.
And now it's even, you don't have to be symptom-free to start doing things gradually.
And that's actually really important. So that's the other thing that we've learned about concussions is that you should not keep kids in a dark room isolated by themselves until their symptoms are better. That's going to make it worse, actually. So kids come in and they're still having headaches and dizziness and all the stuff. And I say, listen, the only thing that's 100% off the table is contact sports. You just can't go back to contact. You can take your dog for a walk around the neighborhood. You can jump in the pool and swim around a little bit. You can go with your mom to the gym and work out. It's fine. You can do all of that stuff as long as you can tolerate it without making your symptoms worse. So I don't want you to feel worse because you're doing that exertion, right? Same thing with school. I want you to go to school. I want you to be with your friends. I want you to try to do all your work. What we're going to do, though, is we're going to give you some accommodations. Limited screen time. No deadlines on anything. Kids may only be able to focus on their work for 10 or 15 minutes. They may not be able to sit and study for 2 hours. So I don't want them to do standardized tests. I don't want them to do tests that will affect their grades long term until they're better. Now, if their teachers say, well, you need to get these homework assignments done, but just do them when you can. Great. That's how I want it. You get the work done eventually, but there's no timeline to it. What that does is that takes the pressure off of the child, right? Especially those type A kids who are straight A students. They get a concussion and they're like, oh my gosh, I cannot focus. Like I can't.
It's like they can feel themselves getting behind.
Exactly.
Right?
They feel, and it ramps up their anxiety, and it just makes everything worse. And so I can at least be that person to say, hey, here are these accommodations. Please work with your teachers. Please work with your guidance counselor. These need to be followed until you're feeling better. And that gives them a sense of relief that, okay, I can focus on my health and getting better, and I don't have to worry about taking the SATs or the ACT or whatever.
Football, just talk about some specific, because that's probably the most common scenario. It seems like for all the hopes of advances in equipment reducing concussion, it hasn't seen a whole lot, although you speak to that. Whereas other interventions such as practices that are contact-free, less contact throughout the week, and proper technique, instruction have made huge differences. So anyway, not talking about the individual child and recognition and treatment, but more the system. Is there anything you would say you would love to see understood more about football and concussions?
Yeah. So football, and I would even say for girls soccer too, this is one of the other things that comes up. There is no such thing as a concussion-proof helmet or a concussion-proof band that you wear around your head. And we talk about specifically in the NFL with these guardian caps that they're wearing, right? That these players are wearing. There's a little bit of data that has shown maybe the guardian caps reduce concussions a little bit, 10 to 15%. But again, this is in a very specific type of athlete. Adults, highest level of football, and usually just in practices. You don't see a lot of those guys wearing the guardian caps in the NFL games because the caps themselves are so heavy. You're not going to put that on a child because, again, a child doesn't have that neck musculature to be able to support that, number one. Number two, if you get hit hard enough, no matter what's on the top of your head, if your brain rattles around inside that skull, you're going to get a concussion, period. What we know works in concussion prevention is exactly what you said. Proper training techniques, reducing contact as much as possible during the practice week, making sure that kids have fully recovered from a concussion before sending them back to sports. Because if you send a child back too early, that in and of itself is a risk for another head injury. And then just education, again, making sure that parents know what to look for, signs to watch out for, and make sure that their kid gets pulled before they wind up having this concussion and they're still playing in that game.
And how do you handle the conversation around recurrent concussions in an individual and potential stopping playing that sport?
So there's no magic number. Parents will ask me that. Well, how many concussions before he has to stop playing football? I'm like, well, again, no magic number. I'll give you an example. You could have a 17-year-old football player who has now had his third concussion not playing football, though. He had one concussion playing football. He had a concussion when he was 12 because he fell off his bike. And he had maybe a concussion when he was 2 because he fell out of his high chair. Those are not repeated concussions that I'm worried about. The repeated concussions that I worry about is 3 or more concussions in a sport over the course of 1 to 2 years. Specifically, if you get 2 concussions in the same season. So let's take, for example, that high school football athlete. They get a concussion in practice in August. We rehab them, get them back. They're doing fine. They have another concussion in October in a game. They're done for the season. I'm not putting that kid back in for the season. 2 concussions in a season back to back, you're done. We'll talk about restarting in the spring. Because what we know is concussions that occur back to back within 6 months of each other have a higher likelihood of a long-term cognitive brain injury, brain deficit. And that's what we're trying to avoid. A child who has 3 concussions in a year from a sport, that's when I'm having a serious conversation with parents and saying, hey, I'm not saying you have to take your child out of the sport, but he's had now 3 concussions in a year. And typically what we see is with each concussion, the symptoms get worse and they last longer. And again, what we know is the more concussions you have in a shorter amount of time, there's an increased risk of long-term cognitive deficits. And the problem with that is that football will not last forever. Football lasts for a finite amount of time. Even if you make it to the NFL, the average NFL player is in the NFL for 3 years. You're done when you're 25 years old. What are you going to do for the rest of your life? And your brain has to take you through the rest of your life.
I've heard
right?
NFL players themselves say NFL stands for not for long. Kind of the idea that they're very aware of this.
Right.
And it's actually a big source of anxiety for them.
Right.
They know this is.
This is my personal opinion. Once you get to that level, the athlete's health doesn't matter. Especially in professional sports, I would really argue professional football and basketball. Because those generate so much money for those organizations, that athlete gets hurt, they're out, they just pull the next one in.
I've seen stuff about various rehabilitation protocols, convergence different therapies that can
vestibular
therapy. Legit and good evidence.
100%.
Okay.
Yes. So there are some things that are out there that are very gimmicky. I don't always agree with those. I've had several patients ask me about some stuff, and I think more of that convergence therapy that you're talking about. A lot of it's, come and pay us $300 and we'll fix your concussion. I don't know that there's a lot of data to back that up. What we do have for sure, 100% that we know works and is definitely covered by your insurance, is something called vestibular physical therapy. So the vestibular system, obviously, you know this, is in between your ears, right? It's your inner ear. And for people who have vertigo, their inner ear, the hair cells and the crystals, they kind of get messed up. Well, they can get messed up in concussions too. They get kind of out of whack. And sometimes you have to do some physical therapy to kind of get those back in the right place. You'll have some eye tracking issues. They'll help with dizziness and headaches and those kind of things. So for my patients that are like the young lady that had the Frisbee injury, she's still having symptoms after 4 to 6 weeks. So she is one that I am recommending to do vestibular therapy.
And they do that through a
And
physical therapist
they
who's
do.
trained in that.
So at Orlando Health, where I work, we have vestibular therapy as part of our physical therapy group. So I can just send them to one of our vestibular therapists. And there's a lot of outside therapy places too. So Ability Select, other physical therapy places, they have vestibular therapy because you don't just use it for concussions. Use it for stroke patients, use it for, again, vertigo patients, Meniere's disease. So there are other uses for vestibular therapy, but we have found that it's very helpful for our concussion patients.
Any predictions about what concussion diagnosis, accuracy of diagnosis and treatment might look like 5 years from now?
That's a good question. I don't know. In fact, I'm part of this study now. Linda Papa over at the RMC ER, she's been one of the pioneering physicians for the traumatic brain injury blood test that they're doing on not necessarily like the concussion patients, but trauma patients that come into the ER and they're unconscious and we don't know what happened to them. Do they have a head injury? Do they not? Do we scan them, right? Do we admit them, radiation for their head to see if they have a brain bleed from their, fall? Or do we do a little finger prick and use an iStat machine in the ER and measure these blood markers to say, okay, this patient has had a brain injury because their blood markers, their protein markers are elevated in their blood. She has been novel in starting that, and now we are moving that to the pediatric population. So we're going to start doing that for peds. Now, again, this is for brain injuries like they fall from height or they're in a car accident or something like that, an unconscious patient. So this is not something right now that we would
mild,
use.
traumatic. These are more moderate, severe, yeah.
This is not something right now that we're going to use on the field. Like a kid comes off and let me prick your finger and see if you've got these biomarkers, right? But in 10 years, in 15 years, we may be using that. So there may not be a test right now, but in 15 years, there may be a test to say, hey, yeah, you've got a concussion. Even though if you're not symptomatic, you got to come out.
All right, overuse injuries.
Yep.
So it probably doesn't need a definition. The term kind of says it, but
Yep.
What are the most common ones you see in your practice?
Well, baseball, which is probably 40% of my practice. Lots of elbow injuries, lots of shoulder injuries. So little league elbow, little league shoulder. Gymnasts, I see a lot of gymnast wrist. And again, these are growth plate injuries. So injuries to the growth plate in the growing athlete. Same thing in the baseball. It's their growth plates, their elbow growth plate, their humerus growth plate.
I'm going to pause you real quick. You probably should say something I think parents know that growth plate injuries are a big deal or potentially a big deal. Give us a quick little snippet explaining what a growth plate injury is and why it's potentially more significant.
Right. So growing children obviously have open growth plates, right? Because this is how their bone grows. For example, in your femur bone and your leg, the two big bones in your leg, your femur bone, your tibia bone, the two growth plates at the knee is where you get the majority of your height because that's how your long bones grow. And so if you have an injury to that growth plate, some of them are fine. Some of them never cause any problems and they're fine. And we just tell you, hey, modify your activities, do ice and Motrin, but you're good. You can still play sports. Where there's other injuries that we're like, no. You have to stop doing this right now and let this growth plate heal. Because if you don't, you can shut down the growth plate. You can close it prematurely and then you won't get to the height that you're at, or you'll get one leg that's longer than the other, or one, in the case of a gymnast wrist, if they get it in both, that's one thing. But if they get it in one and not the other, what will wind up happening is they'll close down the one bone in the forearm, but the other bone in the forearm, the smaller bone that doesn't take all the weight in weight-bearing activity, that one will keep growing. And so then the two bones will be off sync and your wrist won't work appropriately. And so that's why that one is actually really, because that can actually ruin a gymnast career. If they get gymnast wrist at 13 and it isn't recognized, when they're 18, their wrist doesn't work like it used to, and they can't do gymnastics anymore. So that's one of the ones that we really have to be very, very careful. There are some fractures. If you fracture through the growth plate, and we have a whole classification system that we talk about in medicine, but there's a couple on the lower end that are not a big deal, and there's a couple on the higher end that there's a pretty darn good chance that if you fracture that growth plate that way, it's going to close that growth plate. And some injuries, there's just nothing you can do for it. It's just an accident. It just happens. And then what we do is we follow it over time. And if we notice that the one growth plate is closing, we'll go in and we'll have a surgeon go in and close the other growth plate so that then the legs grow equally or, whatever.
But distinguishing those from overuse injuries.
Exactly. Yeah. And some of them are caused by overuse. For example, the gymnast wrist is caused by overuse. It's too much weight-bearing, impactful activity on that growth plate. So that's one of the dangerous ones. But then let's take the femur, for example. In the femur, the femoral growth plate, if you have a fracture through that growth plate, and it's one of the bad fractures, it can stop your leg from growing, or at least that bone, right? So the overuse injuries that are not dangerous, I'll just tell you those, like the little Osgood-Schlatter in the front of the knee, not a big deal. Kids are going to do fine.
Painful.
Right. Oh, really painful.
Right.
Yeah, really painful. But it's all supportive treatment. Same thing with Severs, which is in the heel. So the heel growth plate. Again, not dangerous, not bad. It's just something that kids kind of have to get through. So I tell parents, I'm like, this is growing pains. You're just going to treat it supportively. Ice, Motrin, activity modification, maybe some physical therapy. That's it. But I do tell them, I'm like, until they're done growing, this is going to come and go. So get ready, learn to manage it at home. And I always tell parents, the goal is to get ahead of the pain and stay ahead of the pain so that you can kind of ward it off.
And similar with the Little League elbow, the epicondyle.
Yeah, Little League elbow is a little different. The Little League elbow and Little League shoulder, the problem is that the Little League elbow can wind up, if you don't take care of it, it can wind up fracturing. And if that growth plate fractures far enough away, so the growth plate is where you have the bone, and then if you look on it on an x-ray, you've got the end part of the bone, and then you've got what looks like a little line in the middle, and it looks like they're not even connected. It looks like they're totally separated, but they're not. It's just, that's what we call the physis, and that's just where the bone generates new bone, right? But the problem is that's a point of weakness, and especially in these kids who pitch and put a lot of stress on that elbow, they can actually fracture it. They can break it. So when we talk about Little League elbow, Little League shoulder, it's not technically a fracture. It is an overuse injury. But if you don't address it, it can lead to a fracture, an avulsion fracture. Right. And if that avulsion fracture is more than, we say 5 millimeters, but if it's more than 5 millimeters apart from the regular part of the bone, if they're a pitcher, they need a surgery. They need a surgery to fix it. If you don't fix it, they're going to have issues pitching long term. So again, we go back to these young athletes, 11, 12, 13 years old, and they have this problem. Okay, well, Dr. Davis, what if I just play through it? I'll just take a little time off and play. I'm like, don't do that. If you want to play baseball long term, and they all do, if you want to play baseball long term, you've got to fix this now, because it could end your career 5 or 6 years down the road.
I feel like since you're on baseball, you kind of have to speak to UCL, this dramatic rise of I don't know how much that's talked about in your world. It feels like it's meteoric as far as the increase, and the amount of surgeries kids are having, younger.
So young pitchers, kids that have open growth plates, do not need to be throwing any kind of breaking ball, curveball, knuckleball, slider, anything, nothing. You're 11, 12, 13 years old. You don't have a beard that you have to shave every day and have a deep voice like dad. You're throwing fastballs and changeups, and that's it. Nothing else. And don't go in the backyard and play with your friends that you're going to, we're going to practice curveballs. We know we're not supposed to, but we're going to, no. Please don't do that.
Sneaking around throwing curveballs.
Exactly, because that's what leads to these injuries. Pitch counts are also very important. So Little League Baseball actually puts out, they have published pitch counts that kids need to follow based on their age and based on how much they're playing. So you need to limit the pitch counts. If you do get up to a certain count, then it's going to tell you how many days to take off and you shouldn't be pitching. Velocity is a big issue right now. Every team or a lot of these club teams have radar guns out there, and I get parents that come in. My 9-year-old throws a 90-mile-an-hour fastball. I'm like, that's great, but your 9-year-old's going to burn out by the time he's 15, right? You're gonna burn him out. So we really try to focus on good mechanics, not over pitching and overthrowing, and not worrying about the velocity. I want them to focus on being accurate with the ball, right? And having good mechanics, because those are the things that will keep you out of trouble. And I always tell my families, my goal is to keep you in your sport as long as you want to be in it. And there are certain things that you're going to have to do in order to make that happen. And if you don't do these things, the likelihood that you're going to burn out early is very high. And so I tell them, I'm like, give me the time now and I will give you the time later. If you don't give me the time now, then I'm going to be taking lots of time away from you later, because of these recurrent injuries.
I've heard that about half of all sports injuries are overuse injuries. You think that's about accurate?
I think that's probably accurate. Maybe even more than that, to be totally honest. Yeah.
How do you coach parents and kids about avoiding overuse injuries from a proactive point of view, like taking time off, getting specific with them?
Yeah. Oh, we talk about this a lot. I think what we've seen and why some of those have, I don't want to say they've gone away, but they've become less important is because of sports specialization. Because you're seeing kids, again, let's do the baseball example. Your child has to be playing baseball by the time they're in kindergarten if they want to play baseball in high school. If you don't start by the time you're 5 years old, and that is your sport, you can't play in high school.
Yeah, just for clarification, you're giving voice to the myth that people hold on to, not truth,
right?
But you have to start early.
Yeah. But it is a myth, but it's not too. There is some truth in it because sports for children has gotten so competitive now. There's a good website I would actually address you to go to and check it out. It's called the Aspen Play Project.
Yeah. And
it talks about how we've seen it with like college too, and medical school and law school. You have this funnel effect, right? Everybody, when they're 5 years old, you've got tons of kids playing t-ball and whatever. But as they get older, the funnel takes place, right? And kids get weeded out for multiple reasons. They're not competitive. They don't like it. They want to quit sports. Their parents can't afford it anymore because it's too expensive to travel and to do all the equipment. So there's many reasons why kids stop playing sports. But what we see is the older they get, the more that funnel comes down. And what you have is lots of kids playing sports when they're 5, 6, 7, 8 years old. But by the time a child is 14 in 8th grade and going into 9th grade, 50% of those kids who played sports in kindergarten aren't playing sports any longer because they can't for whatever reason, right? And the Aspen Play Project is trying to reverse that funnel. We're trying to go back to, okay, let's make it a square instead of a funnel. You've got one half of the square is competitive sports. So you're looking for that D1 scholarship. You want to play, you want to be homeschooled or do virtual school because you've got to train 25 hours a week in gymnastics to, again, get a scholarship. Baseball, football, whatever sport it is, basketball, it's all there. Competitive cheer, Top Gun cheer. They're all the same. So put one half of that box competitive and the other half of that box is recreational. So those kids that are like, oh, I'm 14, I want to try my hand at volleyball. Where can a 14-year-old go and play volleyball that's not competitive? There's not. In order to make your high school team to play volleyball, you have had to play on a club team since you were 7 or 8 years old. Kids are getting recruited for colleges for volleyball starting in 7th grade for college.
I've seen studies that say the specialization. So when we say that, we're really saying the giving up of all other sports for the sake of this one.
Right.
That like the AAP has a statement that should not happen before puberty.
It shouldn't.
What you're speaking to isn't your ability
It's
to
not
play.
that.
It's almost the opportunities.
Exactly.
Yeah.
That's the issue.
That's a societal thing.
And
yeah.
right. So that's what the Aspen Play Project is trying to address. They're trying to say, hey, listen, we need to give kids an outlet to where they can still be multi-sport athletes, right? A guy I went to high school with, Chad Pennington, he played for the Jets for
I remember
a long
Chad.
time.
Had him on my fantasy team many times.
Yeah. So
he let me down
Chad,
a lot of
Chad
times,
I went to high school with. Chad was a 3-star athlete when we were in high school. Chad played football. He was actually a better basketball player than he was a football player, and baseball. He played all 3 sports all through college and was all through high school, and was a letterman in all of those. And then went to West Virginia and played, and then of course got drafted. So it's a very different situation.
He played at Marshall, didn't he?
Or not West Virginia.
In West Virginia.
He played at Marshall in West Virginia. Yes, that's what I meant.
Yeah.
But it's a very different story now. Like, kids don't do that. I mean, I have a gymnast. I have a young lady who's a gymnast who her family relocated here from a different state. And now she is going to a big D1 SEC school for gymnastics. But they moved their entire life down here so that she could train at one of the big gyms here to do that. You didn't see that.
Yeah, I've also heard, and I don't know if this is true, I've also heard that some of this actually has resulted from Tiger Woods.
Yeah.
That this featuring this 2-year-old and this 5-year-old on whatever late night TV show he was on, and that we should be seeing Tiger as the exception, not the rule.
Exactly.
That there is that freak elite athlete that specializes, but that's not the story of most, most of the people. Like, I've seen these studies with the elite athlete, the professional athlete, the Olympic athlete, saying they did not want their child to sports specialize at a young age. So I don't know. I mean, how we speak to it, but
you have to get everybody to do it. That's the issue. Everyone has to do it. You have to reverse this whole thing of, well, I've got to get you private lessons. I've got to get you this. I've got to get you this. Like, it's this competition. It's this upping. You have to be better than everyone else. No, we need to put everyone only plays baseball in the spring. And then you have to play 2 other sports in addition to playing baseball. Like, the problem is that you get these kids that play year round, and then they're the ones who just naturally are maybe a little bit better because they play so much. Then they're the ones that get chosen.
But they're also the ones that get overuse injuries.
Exactly.
And then they're also, it seems like, the ones who burn out.
Absolutely. And that's what I was going to say. All of this sports specialization is what has led to increased burnout in kids in sports. We see these kids who are under so much pressure, from themselves, but also from their parents, from their coaches. They don't want to let their peers down. They don't want to let their families down. They wind up with these overuse injuries. Then they're devastated because they have nothing else like that.
An identity.
It's an identity. Their sport is their identity. And then they don't know how to cope with it. They have feelings of increased anxiousness and depression, and their school grades fall. They don't, all of their friendships are in that sport and nowhere else. I mean, it's amazing, all of the ramifications that have come from the early sports specialization, rather than sports being for fun and building leadership skills and building social skills and teaching kids resilience, teaching kids how to be like, okay, I lost that game, but hey, we'll win the next one. Those things are now lost.
It's also, it has to be said, it's a huge industry.
It is a huge
the money
industry.
That's made.
Look at the NIL for college.
Right. But even the money that's made on parent dreams, kid dreams, that I'll help your child and that type of thing. So I've heard, and I don't know if this is the AAP, that during season, at least one day off.
Yes. So this is what I tell my families.
Okay.
1 day off a week.
Yep.
1 week off a month.
Okay.
1 month off a year.
Okay, because I think I've heard 3 months off a year.
Yeah, it doesn't have to be consecutive.
Right.
But at some point, you need to take a month off, a couple of weeks here, a couple of weeks there. But yes, the more time you can take off, and a lot of times what we'll tell kids is do it in the summer. Take time off in the summer. You're going on vacation anyway. Just take a month off, right? I again, going back to the baseball, I tell the baseball kids, I'm like, listen, after the World Series, those guys are done. They're done in October, and they don't come back to spring training until January. So they take all of November, all of December off, and a couple weeks in October. They're getting 2.5 months off, and then they come back in January and start spring training. So, these kids who play year round, I'm like, you have got to take time off. I like, go do something else. Go swim. Go
Do you
play
say
golf.
anything about
go,
them only one team at a time?
Yes.
Okay.
Only one team at a time. And, again, I have kids that only play one position. Oh, I am only a pitcher. That is all I do. And I just shake my head. I'm just like, why don't you hit? I'm not a hitter. I'm just a pitcher. That's all I do. Okay. Again, more risk for injury because that's all they do.
Do you have any specific counseling on stretching?
Yeah. I mean, obviously I tell kids in the beginning, before they start their sport, they need to do more of a dynamic warm up. So, the heel kicks, the little jogs, doing ladders, things like that to warm up. Their static stretching really should be at the end of their workouts. So when your muscles are nice and warm, when you've used your muscles, that's when you actually want to work on flexibility. And I will tell kids, because kids just tend to get tight as they grow. Everybody starts out like Gumby when they're like 6 years old. They're super hypermobile. And then by the time they're 16, they're super tight. And so I will tell kids, especially if they're in a sport like football, basketball, I'm like, do yoga once a week. Even just once a week, do yoga, do Pilates, do something that stretches those muscles, that really promotes those long, lean muscles. The more flexible you are, the less risk of injury you have.
Any ways that you see, maybe use a broad brush for a second, parents, maybe well-meaning, but robbing kids of the joy of sports that you would love to see corrected?
For some parents, just try not to live vicariously through your kids. Like, this is your child, and you need to make sure that your child is happy and healthy and that their mental health is being taken care of, right? And they aren't going down this road of being burned out by the time they're 16.
Yeah, this idea of kind of this phrase, the adultification of youth sports,
right?
And how one of the things that's talked about in just general pediatrics is you've got kids in their home and there's an adult or two with sort of their thumb on them. You need to do this, do this. That's what parenting is. And then you go to school all day and there's 3 or 5 other well-meaning adults with their thumbs on you and then you get to go to your play and there's 5 more adults telling you to do it this way, don't do it that way type of thing. And so it's that organized sports have been one of the things that has infringed upon free play.
Well, and again, going back to how competitive organized sports has gotten.
Right.
If organized sports was more recreational, which is what it used to be, then it's more fun. Because kids are doing it once or twice a week, and it's that, like, let's go to the park and play with my friends and, go play pickup basketball.
Right.
Go play pickup flag football. No refs, no coaches, just kids going out and having fun.
Yeah. Sandlot.
Exactly right.
Fractures.
Yep.
Most common fractures you see, or maybe you mentioned a few of these already. What would be red flags for a parent that this needs to be evaluated immediately?
Yeah. So I get this question a lot. Again, from the competitive athlete. What pain is okay to push through and what pain is not. I always tell, and this is what's really hard, I think, for some adolescent athletes to kind of figure out. They have to figure out the difference between pain and soreness. Soreness is okay. If you have a hard workout and you're sore the next day, you're like, oh, my whole body hurts because I'm sore. Okay, that's soreness. That's going to go away within 24 to 48, maybe 72 hours. It's going to go away. And it is not going to impact your ability to play sports. You're still going to be able to play. You're still going to be able to play at your highest level, and you're going to do fine. What I don't want kids to play through is pain, and pain specifically that is worsening. So pain that is getting worse over time, that starts to affect their ability to be able to play. I'll give you the example of the baseball player with the elbow. They're a pitcher. Their elbow starts hurting. They try to go out and pitch. They can't pitch. They feel like they have a dead arm. They can't generate the velocity that they want to generate. They can't generate the accuracy that they want to generate. They're like, Mom, I can't do it. My arm is just killing me. That needs to be evaluated. The gymnast or the cross-country runner with leg pain. Well, I think it's just shin splints. Okay, is it in both legs? No, it's just in one. That's a red flag for a tibial stress fracture. You have it in both legs and you can run through it. Like, it hurts when you first start, but as you get going, it kind of goes away. That's okay. That's just shin splints. But if from the step you take for your run until you're done with your run, and even an hour after your run, and your one leg is still really throbbing and hurting, and you can kind of push on it and it hurts, that's a red flag for a stress fracture. So again, anything that's worsening, one-sided, affects you being able to do your sport, you need to be evaluated.
All right, let's go to nutrition.
Yep.
Nutrition,
My other
drinks,
favorite topic.
Supplements, good. So I was one of the questions was how much do you get into this? Sounds like you get into it a lot with your
I do a
patients.
lot of nutrition counseling. Yeah. And we're really lucky now on our team. We actually have a sports dietitian that is dedicated to our athletes. So a lot of kids that have questions or parents want to know, is my kid eating enough? I just send them to Kate. I'm like, just go see Kate. I'm like, she'll do a whole food journal. She'll do everything with you. I was like, she's great. But I used to do a lot of it myself.
So is that something someone could do almost like a consult? Because most people are coming to you because of a problem.
Right.
But if they said, I really want my child to be educated in the ways of sports nutrition.
Yes, we do those. We do dietetic consults. I used to do them, but now I just send them to Kate because now I have the dietitian to do it.
Yeah,
so,
that's awesome.
Yeah.
That's good. All right. What about some specific stuff? How about water versus electrolyte replacement drinks?
Yeah. One of my favorite questions.
Oh, good.
So we tend to say water is enough for kids. The only time I would say a sports drink is probably a good idea in the summertime when it's hot, kids are outside for more than an hour. So like, let's say they're outside for a 2-hour practice. Yeah, you might want to give them a bottle of Gatorade and let them drink that. But again, for the most part, in the wintertime, when it's not super hot or when you're only doing an activity for 30 minutes, 45 minutes, an hour at the most, water is perfect. You don't need anything else.
What about just general recommendations regarding protein?
I want all of my child and adolescent athletes to get the majority of their nutrition from their food. When we talk about protein supplementation or talk about kids wanting to gain weight because they want to build more muscle, get bigger, I really want most of that to come from their diet. Now, there are some kids who are just naturally very thin and they work out, they exercise a lot. And so their energy out is more than their energy in, and they have a hard time keeping weight on. Those are kids that we're going to talk about. All right, let's talk about nutritionally dense foods. For example, if you are a milk drinker, you can tolerate milk and cheese and all that. I want your mom buying the full fat vitamin D milk, the whole milk cheese, the whole milk yogurt. I want your mom buying a pint of ice cream. You can eat ice cream after dinner every night. There are certain foods that you can give them because I say they're nutrient dense. For a small amount of that food, there's a lot of nutrition in it. There's a lot of calories, there's a lot of fat, there's a lot of protein. And those are all things for a child who is putting out a lot of energy. They need those extra calories, okay? Another nutrient-dense food, nuts. So almonds, peanuts, cashews, nut butters, your almond butters, your peanut butters, things like that. If you want to add that extra protein in a drink, a little bit of whey protein powder or casein protein is fine. You can do either of those. I think the most common is the whey protein. You can absolutely get a scoop of the unflavored or the vanilla flavor. Just try to avoid the ones with the extra sugar. I also don't want the sugar alcohols. I don't want it to be artificially sweetened, right? But you can get the unsweetened ones, the non-sugar ones, and you can just add that to your milk, add that to your cereal, add that to your yogurt. And then that's just a little extra boost for you. But I really want kids to try to get most of their nutrients from their food and spread it out throughout the day. I don't want you eating a porterhouse steak trying to get all of your protein in one sitting. In general, we say 1 gram of protein per kilo, so per kilogram. So if your child per day.
Yep.
So if your child weighs, let's just say 60 kilos, then that's 60 grams of protein that they need. But that needs to be spread out over 3 meals and 2 to 3 small snacks. So really that's only 10 grams of protein per serving, right?
And that takes a lot of planning.
It sure does, which that's where the nutrition component, if you're doing your nutrition right, it's actually really hard because it takes a lot of journaling. Like you've got to really, and now we could do it on our phones, but you've really got to like keep down like your macronutrients, the micronutrients, the protein, fat, all that stuff. To really do it right, you have to keep track of it. And it's really hard. So I try to give my athletes, I'm like, listen, just make sure you're eating throughout the day and it doesn't have to be huge volumes of food. in the morning for breakfast, hard-boiled egg, piece of toast with peanut butter, and a cup of strawberries or a cup of berries, right? You're getting your fat, your protein, your fiber. For your mid-morning snack, again, an apple and a spoonful of peanut butter. For your lunch, do a turkey sandwich, right? Turkey sandwich on a whole grain bread. You want to add some pretzels in there? Sure, go ahead and have those pretzels, but have a piece of fruit with it too, right? And then for dinner, for a mid-afternoon snack, let's try to get a veggie in, maybe with some ranch dipping sauce. Again, try to get things that kids will eat, but kids that still have good nutritional value, right? And then same thing for dinner. Stick with your lean proteins, your whole grains, your dairy. And that way kids are kind of getting that variety of nutrients throughout the day. Then you don't need to supplement them, right? They're getting their iron, they're getting their micronutrients, their amino acids, they're getting all those things that parents ask me, well, do I need to supplement this? Do I need to give him calcium? I'm like, no, if he's getting enough dairy, if he's getting enough, protein and things like that, if you eat appropriately, you're going to get all the nutrients that you need from your diet.
Anything else that you would love for parents of young athletes just to understand better about this whole topic, sports medicine?
I was an athlete growing up and I loved being involved in sports. And my goal as a sports medicine doctor is to keep kids healthy and to keep them involved in sports, because I think the overarching benefits of sports participation far outweighs
That's right.
the negative. I just really try to encourage kids to do what they love. I want their parents to support them in what they love. And I just want them to be happy, healthy teenagers. That's really my goal in what I do.
You want to help kids experience the joy that sports brings.
Mm-hmm.
And in some ways, this overemphasis on results
Mm-hmm.
can be a robber of
It
the joy
can.
that sports can bring. And so,
But two, that being said, as competitive as sports has gotten, it still can teach resilience.
yes,
It can teach resilience. There are a lot of things that kids experience playing sports that they're going to experience in their adult life, in their job, in their social settings. And I think dealing with that as a teenager can help them know how to deal with it as an adult.
no question. These are little test cases and trial
Exactly.
runs for life. Yeah.
Because they still have mom and dad.
Any particular sources for good information that you point people towards?
Yeah. So the Heads Up website from the CDC is excellent for concussions. The Aspen Project Play, I love that website for just sports and the benefits of sports. In terms of nutrition, I love the myplate.gov. There's a lot of good information there. And then in terms of sports injuries, the AAP has healthychildren.org, which is a great website. And then the American Academy of Orthopedic Surgeons, so AOSS, I can't remember the acronym, American Academy, AAOSS, has wonderful patient information for injuries. So if your kid gets injured, whatever the American Academy of Orthopedic Surgeons says on their little website, they have all these different injury prevention things. That's all good information out there.
Good stuff.
Yeah.
All right. We have some rapid fire questions. You just have
Perfect.
to answer top of head. I just am going to add a couple. Did you ever have any crushes on a UT athlete growing up?
No, not that I know of.
Okay. All right. That's fine. Favorite Florida sports team?
Oh, I have to say the Orlando Pride. I love the soccer girls.
Good.
Yeah.
Favorite non-Florida sports team?
Oh, University of Tennessee. Go Vols.
Okay. So you work with both ballet and soccer?
I do.
Okay.
Mm-hmm.
So which would do better? Your ballet athletes participating in the soccer club or your soccer athletes participating in ballet?
Oh, the ballerinas would definitely do better participating in soccer.
You sure about that?
Yeah.
All right. The next Olympics are going to have 5 additional sports that are not traditional ones: flag football, squash, cricket, lacrosse, softball.
Mm-hmm.
If you had to, between now and then, work on one of these sports and try to participate, which of those 5?
Flag football.
Oh, yeah?
Yes.
Big fan?
Yes.
Yeah?
I think flag football is great. I love how it's coming on for girls.
Yeah.
Flag football for girls is great.
And your flag football skills, are you flag puller? Are you shifty?
Oh, I would be a puller.
You
Oh,
would
yeah,
be,
100%.
okay.
I'd be a
Defense.
puller.
Got it.
Yeah.
I have heard that the restaurant at the Jewett Hospital may be the best restaurant in all of Orlando.
Our bougie food that we have.
You would say that's true.
It's wonderful.
And what is your order? What's the recommended order?
Well, it depends on what the food of the day is.
Okay.
Because they do Italian, or they'll do Haitian, or they'll do Creole, or they'll do whatever. My favorite is probably when they do the Italian.
Wow.
I love their bolognese and pasta. It's delicious. Or their tacos. Their tacos are really good too.
That's a good word. Elizabeth Davis, thank you so much for being with us.
Thanks for having me.
Yeah, the point of all this, I mean, call
Lots
it caring
of good
well.
stuff to talk about.
Yeah, and we are wanting to help our parents care well for their kids. And the main way we're doing that is showing them people in our community who are doing such a great job caring well for them. So thank you for doing that.
Thank you.
And stay at it.
All right, thanks.
Yep.